Elizabethingia is a bacteria that's found in dirt, in water, in the environment, everywhere actually, and it's not a problem for most people. Most of us breathe or eat or touch organisms like this all the time. It's only if we have an underlying health problem, a depressed immune system because of cancer chemotherapy, liver damage, that kind of thing, that can make us more susceptible to a severe infection. So even though the organism is really common, it's everywhere, we don't see that many infections caused by it. I think the estimate that we've heard of is about 2 to 5 cases in every state per year. So it's not zero, but it's pretty uncommon. So when we see a new organism come up like this, and we do pretty often, we need to find out how it's getting from where it lives to where it's causing an infection. How is it getting into a patient? To do that, we look at all of the risk factors either in the patient's environment or in products that the patient may have used, and try to find a connection both statistically, just crunching a lot of numbers, doing a lot of chart review, and also by culturing the environmental surfaces, water in the environment, products that they might have used, to see if we can find the bacterium there as well. So it's still early. We're working very hard to test as many things that make sense as we possibly can. We're looking very widely at all of the things that these individuals might have been exposed to. So far, nothing has lit up, which is also good news. It means that of the household items that we've tested, of the medical products that we've looked at, everything so far is negative. The minute we have a positive signal, we'll be able to reach out and let people know so that we can have fewer of these cases. When there are clear connections, like a single hospital being affected or a single neighborhood, that makes it a lot easier for us to pin down the problem. In a case like this, where the patients are very widespread, they're across a broad geographic area in Wisconsin, they haven't shared a single hospital, they don't all live together, they're not on one water system, it means that we have to search much harder for a common cause. So in circumstances like this, early detection is key. We want people who have a fever or are feeling run down and might have a skin infection, for example, a red patch that's sore and itchy, to seek care promptly. See your doctor, make sure that it's evaluated, and if necessary, make sure that cultures are taken. We want to make sure that patients who have the infection are identified and treated quickly and correctly.